When we're monitoring ongoing cancer treatment, we're going to recommend two different types of monitoring. We're going to recommend blood-based monitoring with ctDNA and liquid RNA, and we're going to recommend PET-CT imaging. PET-CT imaging is the best imaging scan for cancer because it tells you in the scan if something is malignant or not, and it's an excellent way to tell whether your cancer treatment is working because it will show how big that mass is still and how hot it is, the serum uptake value, and that helps us to know if those masses are dying, even if they're still there. You see, with a CT, all you can see is the mass. It shows the shapes and shadows, and it takes quite a while for a tumor to actually dissolve. So you can have a very effective therapy, but your masses will still look the same. And actually, with immune therapies, tumors can even look a little bit bigger initially due to something called pseudoprogression. So we like PET-CT scan because the SUV information tells us how hot those tumors are. In other words, how aggressive or how live they are still. We like blood-based monitoring because that helps us to see with even more accuracy if your targeted therapy is affecting the genes that it's supposed to be affecting. So we would do a blood-based test before you start your therapy, ideally, and that tells us kind of our baseline, where we're starting with you. And then we'd monitor within 3 weeks of you starting your treatment, and we'd be able to tell you with 99.9% accuracy if your treatment is working at all and to what extent. For people who are late stage, this is a very critical thing because you do not have 6 months and repeated CT scans to wait to find out whether your treatment is working. So the combination of these blood-based assays, which can tell you within just 3 weeks of starting treatment if it's effective for you, and then the PET-CT scan as opposed to the CT, is going to be a much more comprehensive and accurate assessment of if your cancer treatment is working.